Welcome back, folks. Today, we're diving into a topic that's all about staying ahead of the game: stroke prevention. Buckle up because we're about to uncover the ultimate tips to keep your heart strong and your health soaring. Calling all former smokers. We're showcasing the incredible journey of how kicking the habit powers up your defense against stroke. Get ready to take charge and unlock the secrets to a life full of vitality. Here are the top three stroke prevention tips. Number one, blood sugar targets. Blood pressure is measured in millimeters of mercury and is presented as two numbers: systolic, the higher number, and diastolic, the lower number. The recommended blood pressure target for most adults is below 130 over 80 mmHg. However, individual targets may vary based on age, overall health, and underlying medical conditions. Lifestyle modifications, dietary approaches. Adapt the DASH diet, which emphasizes fruits, vegetables, whole grains, lean proteins, and low fat dairy products. This diet's high potassium and low sodium content helps lower blood pressure. Reducing sodium. Aim to consume no more than 2,300 milligrams of sodium per day, about 1 teaspoon of salt. Processed foods, fast foods, and restaurant meals often contain high levels of sodium. Limit alcohol. If you choose to drink alcohol, do so in moderation. For men, these means up to 2 drinks per day. For women, it's up to 1 drink per day. Regular physical activity. Engage in aerobic exercise such as brisk walking, jogging, cycling, or swimming. Aim for at least 150 minutes of moderate intensity aerobic activity per week. Weight management. Losing excess weight can significantly lower blood pressure. Even modest weight loss can make a substantial difference. Stress reduction. Chronic stress can contribute to elevated blood pressure. Practice stress reduction techniques such as meditation, yoga, deep breathing, and mindfulness. Medications. Prescription medications. If lifestyle changes alone are not sufficient to control blood pressure, your healthcare provider may prescribe medications. Common classes of antihypertensive medications include diuretics, ACE inhibitors, angiotensin II receptor blocks, beta blockers, and calcium channel blockers. Combination therapy. In some cases, a combination of two or more medications may be needed to achieve optimal blood pressure control. Regular monitoring. If you're taking medications, work with your doctor to monitor your blood pressure regularly. Adjustments to medication dosages may be necessary over time. Number two, DASH diet. Dietary approaches to stop hypertension. The DASH diet is a well researched eating plan designed to reduce blood pressure and promote overall heart health. It's rich in nutrients that help lower blood pressure, reduce inflammation, and support healthy blood vessels. Key components of a healthy diet: fruits and vegetables. Aim for a colorful variety of fruits and vegetables. They're packed with vitamins, minerals, antioxidants, and dietary fiber that support cardiovascular health. Whole grains. Opt for whole grains such as brown rice, quinoa, whole wheat, oats, and barley. These grains are higher in fiber and nutrients compared to refined grains. Lean proteins. Choose lean sources of protein, such as skinless poultry, fish, beans, lentils, and tofu. These options are lower in saturated fats and support muscle health. Healthy fats include sources of healthy fats like avocados, nuts, seeds, and olive oil. These fats help lower bad cholesterol levels and reduce inflammation. Low fat dairy. If you consume dairy, opt for low fat or fat free versions of milk. yogurt, and cheese to reduce saturated fat intake. Limit added sugars. Minimize consumption of sugary beverages, sweets, and processed foods that contain added sugars. Check food labels to identify hidden sugars. Reduce sodium. Choose fresh, whole foods over processed foods to naturally lower your sodium intake. Flavor your meals with herbs and spices instead of salt. Meal planning tips. Balanced meals. Aim for balanced meals that include a combination of lean proteins, whole grains, and plenty of fruits and vegetables. Portion control. Be mindful of portion sizes to avoid overeating. Use smaller plates to help control portion sizes visually. Snacking. Opt for healthy snacks like fresh fruit, raw vegetables with hummus, Greek yogurt, and nuts. Hydration. Drink plenty of water throughout the day. Limit sugary drinks and excessive caffeine. Number three, quit smoking. Smoking is a powerful risk factor for stroke as it damages blood vessels, increases blood pressure, and promotes the formation of blood clots. Here is a deeper look at how quitting smoking benefits stroke prevention. Reduced stroke risk. Smoking damages blood vessels, increases blood pressure, and promotes the formation of blood clots, all of which contribute to stroke risk. Quitting smoking significantly reduces these risks. Blood vessel health. Smoking harms the inner lining of blood vessels, making them more prone to plaque buildup that can lead to blockages. When blood vessels are healthy, blood flow to the brain is improved, lowering the risk of stroke. Blood pressure control. Nicotine in cigarettes increases heart rate and blood pressure. When you quit smoking, your heart rate and blood pressure gradually return to normal levels, reducing strain on your cardiovascular system. Reduced inflammation. Smoking triggers inflammation throughout the body, which can damage blood vessels and contribute to the development of atherosclerosis. Quitting smoking helps to lower inflammation levels. Less clot formation. Smoking increases the risk of blood clots by making blood more prone to clotting. Blood clots can block blood vessels and lead to stroke. When you quit smoking, the risk of clot formation decreases. Improved oxygen levels. Smoking reduces oxygen levels in the blood, which can strain the cardiovascular system. When you quit, oxygen levels improve, benefiting your heart and blood vessels. Healthier cholesterol levels. Smoking can lower levels of HDL, which is good cholesterol, and increase levels of LDL, which is bad cholesterol, promoting atherosclerosis. Quitting smoking can help improve your cholesterol profile. Accelerated healing. After quitting smoking, your body begins to heal immediately. Within just a few hours, your heart rate and blood pressure start to drop, and carbon monoxide levels in your blood decrease. Long term benefits. Over time, the benefits of quitting smoking compound. Within a few years of quitting, your stroke risk can decrease significantly, and your overall cardiovascular health improves. Supports overall health. Quitting smoking doesn't just reduce the risk of stroke, it also lowers your risk of heart disease, lung disease, and various cancers. It contributes to better lung function and improved overall quality of life. Passive smoke exposure. If you are a non smoker but are exposed to secondhand smoke, your stroke risk can still increase. Reducing exposure to secondhand smoke is crucial for stroke prevention. Behavioral changes. Quitting smoking often involves adopting healthier habits, such as increased physical activity and improved diet. These changes further support stroke prevention. Remember, quitting smoking can be challenging due to nicotine addiction. but the benefits far outweigh the difficulties. Seek support from healthcare professionals. Nicotine replacement therapy, counseling, support groups, friends, and family. Don't get discouraged if you experience setbacks. Many people make multiple attempts before successfully quitting. Each effort brings you closer to a healthier, smoke free life and a significantly reduced risk of stroke. Well, folks, that's a wrap on our stroke prevention journey. Now you're armed with knowledge and ready to give strokes a run for their money. Remember, every healthy choice is a step toward victory. And hey, if veggies can conquer plates, you can conquer anything. Keep those heart healthy habits going strong. Subscribe, stick around, and let's keep making health the coolest trend out there. Stay awesome, stay healthy, and stay tuned.